The first lawsuit has been filed over the death of a Korean War veteran at the Holyoke Soldiers Home, one of at least 76 veterans to have died of coronavirus there. The lawsuit names 5 officials, including the then superintendent and former state secretary of Veterans Affairs, accusing them of acting with deliberate indifference to the risks posed by the COVID-19 pandemic and saying the spread of COVID-19 was preventable. The lawsuit seeks class action status, meaning others could join in. As we told you last week, the Home's Board of Trustees did pass 2 packages of reforms to address some of the issues laid out in a report last month, commissioned by the governor, which called the critical decisions made by Soldiers Home leadership in the early days of the pandemic, quote, utterly baffling from an infection control perspective. It also said the Department of Veterans Services failed to effectively oversee the home. 3 other investigations are still ongoing, and we promised you when the story first broke that we would stay on top of it. But that effort has proven extremely difficult. Here's why. We've repeatedly invited Governor Charlie Baker and State Health and Human Services Secretary Mary Lou Sudders to join us, but the governor's office has not responded to any of our requests. We've also invited former federal prosecutor Mark Perlstein, who wrote that report I just showed you, but he says he needs to get approval from the governor's office to do interviews. And again, when we sought such approval, repeatedly, no response from them. I can't remember anything quite like this. But one person who has agreed to join us is a former deputy superintendent at the home who resigned in 2015, retired Air Force Lieutenant Colonel John Paradis. He's now an organizer with the grassroots group Holyoke Soldiers Home Coalition. So good to meet you. Thanks so much for joining me. I appreciate it.
You're welcome, Jim. Glad to be on the program.
I want to read a line from your testimony in front of a legislative committee just a few days ago. I resigned in 2015 as the deputy superintendent of the home in Holyoke because of the failure of the Commonwealth to truly understand the human, physical, and financial resources necessary to accomplish our mission to provide the best possible care for veterans with honor and dignity. Failure to understand what specifically?
Yeah, it was the entire system, really. Chronic staffing shortages, mandated overtime, infrastructure and facility upgrades that were much needed. And quite honestly, I think the frustration for our leadership team at the time was just being able to be forthcoming with these issues and getting a lack of any reciprocity as far as understanding or really the ability to sit down and really understand the complexity of the issues that we were facing.
So the state was aware of the concerns that you and the superintendent at the time voiced. Did they do anything to address those concerns from your perspective?
Well, clearly not to the level of sufficiency that we felt was necessary in order to provide the quality of care that our veterans deserve, care with honor and dignity, which is the mission of the Soldiers Home in Holyoke. And we clearly were not meeting those expectations from the feedback we were receiving from our staff, or from the veteran residents, and most importantly, from the family members who every day would see the shortcomings and how difficult it was to be able to provide the level of care that we felt was necessary for our veterans to live with dignity.
We should be clear here. Your term as deputy superintendent, well, and another job at the home as well, didn't just begin under the Baker administration. You were there for the end of the Patrick administration. Was the same failure to respond, in your estimation, did it exist in both the Patrick and the Baker administrations?
I think so, to some degree. I think this is something that really built up over a number of years. It wasn't just this current administration. The Soldiers Home in Holyoke would typically get a nominal increase in our budget each year, but never really, by any means, clearly enough to keep up with just cost of living increases, salary increases, just what it takes to run a facility. But I think the key, Jim, is that we were starting to get traction and starting to have a conversation with then Secretary Polanowitz with the Executive Office of Health and Human Services to really get an understanding of what we needed to do to move forward. And then after the Baker administration came in with really a campaign of austerity, it we didn't get anywhere after that.
You know, I mentioned to you that in the litigation that's been filed on behalf of this one veteran, the pleadings say that the deaths were preventable. If the concerns that you and others raised had been adequately addressed, do you think these deaths would have happened, or at least in the volume that they happened in?
You know, obviously it's hard with this pandemic, and there's no bulwark against being able to prevent anything like this with COVID-19. But it's clear that shortages in staffing, infection control practices, just the dynamic of the facility, its size, and the closeness in which veterans are cared for, and having 3, in some cases 4 veterans in a small cramped space. All of those things contributed, certainly, and I think it's borne out in the Pearlstein investigation. I'm certain it will be borne out in the other investigations and the legislative inquiry that's forthcoming as well.
One by the U.S. Attorney, one by the Attorney General, and as you say, the legislature. Did the Pearlstein report place blame where it belonged? The primary blame was on the most recent superintendent who's on administrative leave. But on the other hand, Attorney General Healey, again, without having completed an investigation, said of the Pearlstein report, lays bare systemic failure of oversight by the Baker administration in adequately preparing, staffing, and responding to the crisis to protect our veterans. Who got it right there?
Well, I'd say, you know, this happened on the Baker-Polito administration's watch. You know, they can certainly point the blame toward the superintendent and others within the Soldiers Home in Holyoke, but there were ample opportunities. If you talk to union representatives at the Soldiers Home, where they brought up these chronic staffing shortages and other issues, I think it's really disheartening to see. There's, in my opinion, I think many of us who have read the report think that there are certainly some omissions within the report that don't really look at some of the underlying contributors to the pandemic that really, in our mind, fall much higher up the chain of command, if you will.
Like what? Give me a quick one if you can. Like what?
Well, I would say certainly when I heard the press conference the day after the Pearlstein inquiry, and I heard Secretary Sutters talk about that, and her, you know, in her history in healthcare, she would do roundings at you know, hospitals and such. And I'm thinking, well, if you knew that the superintendent of the Soldiers Home, with his lack of credentials in healthcare experience, and you knew that something as insidious as COVID-19 was about to occur, wouldn't you have, you know, really taken the time to understand how prepared that facility was to combat a pandemic, the nature of COVID-19?
John Paradis, I know that you have, as part of your work with this coalition, have major thoughts about how these veterans going forward are to be adequately served. But the Baker administration, we only have a minute left, proposed, I think, about a dozen reforms. You testified in front of the Legislative Committee last week asking them not to adopt these reforms. Why not do these now and then build on that later?
Right, because you still have 2 investigations. You have a legislative inquiry. We don't know yet what are the outcomes of those. I think for us as a coalition, for the veteran family members, for the 30-plus people that we have looking at this each and every day, our biggest concern right now is that the state is not going to get this right for future generations. You know, we need a new facility. We need to look at the highest standards of care that our veterans have deserved. And, you know, that's what the state should be concentrating on right now. And quite frankly, based on your opening, Jim, that our biggest concern is that we, the veterans and the family members, they're going to live with this new facility for the next 70, 100 years or more. You know, we want to make sure we have a voice in this process. They should be listening to us, how we want to live in a long-term care facility. This is going to impact us for the rest of our lives. And we want to make sure that the state gets that right.
John Paradis, I really appreciate your spending time with me, and I hope you'll join me again as this proceeds. Thank you.
Thanks, Jim.